to see if opening of lockdowns has worked by counting the cases in the ICUs or counting the bodies in the morgue. That is not the way to know something has gone wrong. The way to know that the disease is coming back is to have community-based surveillance, to be testing, and to know the problem is coming back, and then be able to adjust your public health measures accordingly. Let us not go back to a situation where we don't know what's happening until our hospitals are overflowing. That is not a good way to do business.
The phrase lockdown. I think there's this misconception that a lockdown is one thing. It's not. It's a set of measures that countries have taken. They include, individual and community level restrictions of movements, or some of them are called stay-at-home orders. They include closures of different types of facilities, whether these are schools or workplaces, partial closure or full closure. We should say that not all countries did school closure. Not all countries closed all their workplaces. They include closures of bars and nightclubs. They include, restrictions or limiting of mass gatherings and sporting events. And so this use of the word lockdown, it makes it sound like an entire country has shut down overnight. And it's just not the case. So what we're seeing in a number of countries, and where we're seeing more success in this, and we are constantly learning, we have to keep saying that. There is no one solution here that you must do this or you must do that. It must be a comprehensive approach. And in some countries, they've looked at the virus. They've looked at where's the intensity of transmission. Where do we need to impose some of these measures in terms of restricting people's movements and putting stay-at-home orders in? And where do we need to lift them when the situation changes? And I think we need to get into this mindset that it's going to take some time to come out of this pandemic, whatever that looks like, including the lifting of these measures in a slow, in a staggered way, which will differ, based on the country itself. You may see a lifting in some parts of the country where it's staying in place in others. And as the virus is either controlled or it has found a place to take off and resurge, those measures may need to be put in place again. And I think that having the communities and having all of us understand that they may need to be lifted, they may need to be implemented again, I think we need to be ready for that. And it's important that countries have the systems in place to be able to rapidly detect cases and then take appropriate actions. So I just wanted to comment on the use of this word lockdown, because it isn't an all or nothing. And we need to find the new normal as we go forward in managing the risk of resurgence and protecting people's health while getting people back to living their daily lives.
Just stop now, but we can come again, so it's just a break. Next question is for Shane Zhu from CCTV.
From the long-term care facilities, how could this happen? Or is it because of the idea of herd immunity that was talked and discussed before in the previous briefing? Or there's lack of the care for this vulnerable group? Thank you.
Unfortunately, happened all over the world, and many countries have been affected by this around the world. And in that sense, it is a tragedy. We've spoken about that many times. There are many, obviously, factors driving this. The population of people who live in long-term care settings are very often older and have many have underlying conditions. So we're a very vulnerable community from that perspective. The long-term care sector is not like the hospital sector. It's people are living in very many different types of settings. It's not around the world. It's not a standardized setting, and some long-term care facilities can have many residents who are being served by a relatively small number of staff, who may or may not have lots and lots of training in healthcare provision and infection prevention and control, and those standards will vary greatly from country to country. But I think the one thing that most countries would accept is that we haven't managed to shield those centres from disease entering, and when the disease has entered those long-term